faculty member of the John Hopkins Center for Injury Research and Policy since 1992. He's published articles on firearm policy, youth gun acquisition and carrying, and prevention of gun violence, intimate partner violence, and adolescent violence prevention. He studied the effects of a variety of violence prevention interventions, including state firearms policies, community programs to change social norms concerning violence, public education, and advocacy campaigns, and school-based curricula. Thank you very much. Here's Daniel Webster.
Hi, thanks. I'm really happy to be here. I'm based at the Johns Hopkins School of Public Health, and I've been teaching a course on violence prevention there, trying to sort of apply public health principles to the problem of violence. And much of my work is focused on prevention of gun violence. So I'm trying to intersect some of my research interest and so what I do on the teaching front as well. Make sure. The lighting is not very good in here. I apologize. This man is Leon Farouk, and I just sort of want to recognize him today and sort of dedicate this session to him. Leon passed away on Wednesday, and I'm going to tell you a little bit about really some of the magic that he worked in East Baltimore, less than a mile from our campus, to help turn around what was one of the most violent parts of an already incredibly violent city into a very different place. His memorial service was today, and I'm sorry that I cannot be there for it. So public health people come in many varieties with many kinds of disciplines and ways they look at things. Epidemiologists sort of often focus, at least begin their examination, trying to figure out, well, who's at risk? Who are the high-risk groups and populations? We have plenty of behavioral scientists in our school that focus on behaviors. How do we change unhealthy, unsafe behaviors, the attitudes behind those? So a way to address, examine, and try to prevent violence is to address those behaviors and the attitudes that support violence. Another very interesting and I think very useful way to view this problem from a public health lens is to think about gun violence as a social contagion process. And that is sort of behind the thinking of a key public health strategy developed by Gary Slutkin at University of Illinois School of Public Health, the Chicago ceasefire that I'm going to talk about just momentarily. Yet another way to think about violence, gun violence, and one that became very natural to me as I entered this field is to focus on the environmental conditions that sort of allow and facilitate gun violence. And that ranges anywhere from the availability of guns to concentrated poverty and disadvantage. So I'm going to begin talking about this model that maybe many of you have heard about, and actually in your materials that you received, there's a lot of information about this program that hopefully Columbus group will get funded to try to launch that initiative here in Columbus. Here are sort of the core elements of this model. There's a street intervention component, a client outreach, that outreach to identify who are the people in a particular community that you think might be most at risk for either being a perpetrator or a victim of gun violence. Clergy is key to this process, particularly as it involves changing social norms. Mobilizing community is also key to this. All these are trying to, at the individual level, widen decision alternatives for individuals, to give them alternatives for violence. to change the norms that sort of support gun violence. And part of the way that is facilitated is by focusing on what are the risks and costs of the different behaviors, the different choices that are available to individuals. So in that context, law enforcement can be important, as well as educational campaigns that sort of highlight both issues around the attitudes and norms as well as the risk and cost. The target group for this intervention has been those ages 16 to 25 years old. If anybody has ever looked at a graph of age distribution of gun violence, it's no mystery why that is the target group. This is just sort of I'm going to fly through some of these, just I'm wanting to give you a flavor of sort of what this looks like and what this program is about. Here's some outreach workers in Chicago telling about what they're doing and trying to identify potential clients for their programs. I'll show you just some of the public education campaign messaging. Very simple, stop killing people. Dr. Slutkin, prior to getting into the issue of gun violence prevention, worked on preventing HIV and AIDS in places like Africa, and the success behind a lot of his efforts there had to do with very simple, direct messaging directed at behavior change. The messages vary a little bit depending on the population and what they're trying to get you to do. Some directed directly at individuals who might potentially pull the trigger. This one I found very interesting. When we did some research with crime-involved youth in the Baltimore area, and we asked them things about, what steered them away from gun violence. We're interested in both sort of what drove them towards gun violence, but also the opposite as well. And one of the most common responses they got was concern about younger siblings or young people that they're close to. This is reinforcing sort of the risk side of the equation that I was mentioning before. So the program had been in operation for a good number of years. And I was very intrigued by it. I have to say I was very skeptical. It sounded great, but it seemed to me a little bit overly optimistic. I just wasn't sure that they were going to be able to pull it off. And the program had shown some data that had some suggestion of effectiveness, but it wasn't very rigorous. And it took them a long time until there was an external evaluation done by some researchers at Northwestern University, led by Wes Scogan. And I'm just going to summarize their findings. The report is, about yay thick, but just to get the core things here. They looked at 7 areas in which they implemented this program, in which they had a fair amount of follow-up time. In this case, they had a minimum of 33 months after the program's inception in these 7 intervention sites. And they did fairly sophisticated longitudinal analysis methods. What they found was that in 6 of the sites, there were very significant reductions in shootings, and at least in 5 that they were able to clearly link it to the program as far as a distinct association with the onset of the program. And the effect ranges from 16% reduction in shootings to 34%. In some areas, they had more detailed information about the nature of homicides, and in those 4 sites where that was the case, retaliatory homicides, which was a key thing that they were targeting,